Non-governmental organization Kherson continues to cooperate with international medical organization, Médecins du Monde France, in order to restore access to medical services for residents in the frontline regions in Mykolaiv and Kherson regions. The war not only destroyed buildings but also restricted access to medical services. For a long time, residents in frontline villages in southern Ukraine, including Tamaryne, were unable to receive the necessary healthcare. Through the combined efforts of mobile medical teams and telemedicine centers, Kherson's team is expanding communities' access to health services. Patients don't have to deal with their health issues on their own anymore.
I was here during the occupation, and there was no access to medicine at all. All we have left here, all the medicines, because there was no access, neither to Snihurivka nor to Kherson. Everything was cut off. But after we were deoccupied, medical teams started coming, and things got a little easier for us.
Once a month, medical team visits communities where access to specialized medical care is limited or completely unavailable. Thanks to the mobile teams, it becomes possible to diagnose and detect complex diseases at early stages.
When the mobile team arrives and performs examinations that require in-person contact, it becomes much easier for the doctor to adjust treatment remotely, make prescriptions, and plan further diagnostic and treatment steps.
In communities where rural health posts and outpatient clinics have been destroyed or have only one room, the medical trailer, health room, operates, which is equipped with everything necessary to create a comfortable environment for both doctors and patients.
Mobile medical teams and telemedicine centers work as a single system. Through the mobile teams, we organize visits of specialists who need direct physical contact with patients, for example ophthalmologists, ultrasound specialists, and gynecologists. After the initial examinations, patients can be referred for additional consultations with specialists through telemedicine.
After undergoing an examination by the mobile medical team, the patient receives examination results and has the opportunity to receive additional consultation or continue their treatment at the telemedicine center. The patient can consult with a doctor based in any city in Ukraine, take rapid tests, and check levels of hemoglobin, cholesterol, glucose, or other indicators. Residents of the village of Tamaryne will no longer need to travel hundreds of kilometers to the regional center. Instead, they can simply visit the local clinic.
Work has become much more interesting. It also helps improve our professional knowledge. You communicate more often with doctors, you naturally gain more experience. We are grateful to the donor for this format and thankful to our colleagues who work within it and made it possible for us to use these services.
Telemedicine does not replace the local healthcare system, it strengthens it. Telemedical access to specialists expands the capabilities of local healthcare workers to perform additional diagnostics on patients and form a more complete picture of the disease. Kherson's team not only installs necessary equipment but also provides training for healthcare workers on how to perform necessary examinations using specialized medical equipment and how to plan and organize telemedicine consultations with doctors from across Ukraine. Telemedicine is not just about accessibility of medical services for the local community. It is also about supporting healthcare practitioners in remote areas. This creates a comprehensive system in which patients are not left to cope with their illness on their own, and nurses are relieved of the responsibility of expecting patients to seek treatment. The project is funded by the European Union and implemented in cooperation with the international medical organization Médecins du Monde France.
Médecins du Monde France, together with our partners Kherson's, monitors and evaluates how the project outgoing. It is important for both patients and donors that healthcare services remain high quality. Monitoring team, together with the medical manager, conducts field visits, patient surveys, and data analysis. Together with Kherson's team, we have also introduced an accountability system where every patient can leave feedback, complaints, suggestions, or words of gratitude.
Today, the village of continues to live under constant security threats. Artillery strikes and FPV drones regularly target the surrounding areas. Despite these challenges, the people working here remain committed to their mission and continue doing everything possible to maintain and improve access to healthcare services.